and today I am going to perform three different procedures. First, starting an intravenous infusion. Second, regulating IV flow rate. And lastly, discontinuing IV infusion. The purposes of starting an IV infusion: first, to maintain or replace body stores of water, electrolytes, vitamins, proteins, fats, and calories in the clients who cannot maintain an adequate intake in the mouth. Second, to restore acid-base balance. Third, to restore volume of blood components. Fourth, administer safe and effective infusions of medications by using the appropriate vascular access. And lastly, to establish a lifeline for rapidly needed medication. Here are the materials needed for the first procedure: IV fluid, IV tubing, gauze pad, scissor, IV cannula 18 gauge for adult, tourniquet, surgical tape, surgical gloves, dry cotton ball, and wet cotton balls. So let's proceed to the step-by-step process of this procedure. First procedure, check the doctor's order and make an IV label to ensure that the client receives the correct IV solution and medications as needed as ordered by the physician. Gather all the equipment and prepare the IV solution and tubing. Having all the equipment needed saves time. Wash hands. This prevents the spread of microorganisms. Check the IV solution, especially the expiration date. So this IV solution will expire on July 2024. And then check the IV tubing for the instruction and the expiration date as well. So make sure that the materials are updated and not expired. Maintain aseptic technique when opening sterile package and IV solution. This prevents the contamination of IV solution and set, which can infect rapidly the client. Assess IV tubing for kinks or bends. Kinks or bends in tubing may decrease or stop the flow of IV fluids. Clamp tubing, uncap the spike and insert it into the entry site on the bag or bottle as the manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. This punctures the seal in the IV bag or bottle. Then suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it to fill at least halfway. Suction effect causes fluids to move into the drip chamber and also prevents air from moving down the tubing. Remove the cap at the end of tubing. Release the clamp and allow the fluid to move through the tubing. Allow the fluid to flow until air bubbles have disappeared. Close the clamp and recap the end of the tubing. This removes air from the tubing, which can in larger amounts act as an air embolus. Identify the client and explain the procedure. Explanation allays the client's anxiety. Hello ma'am, good morning. I am Saima Mamatas, your student nurse for today, and we are going to give you intravenous fluid on your hand to maintain your electrolytes. Have the client in supine position in bed. The supine position permits either arm to be used and allows for good body alignment. Suspend the bag of solution on the IV stand. The fluid height should be 18 to 24 inches above level of the vein. This height is sufficient to overcome the venous pressure. Hand the tourniquet to the doctor, followed by a CB with alcohol and the needle. Observe while the doctor is inserting. Anticipating the needs of the doctor is one of the good characteristics of a nurse. Connect the tubing to the needle and start the flow of solution promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration because blood will clot readily if IV flow is not maintained. Support the needle with small piece of gauze under the hub if necessary to keep the needle in place. The pressure of the wall of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored. And loop the tubing near the site of the entry and anchor it with plaster to prevent the pulling of the needle.
Anchor the arm to an arm board for support if necessary. An arm board protects against change in the position of the vein and acts as a reminder to the client to minimize arm movements. Adjust the rate of flow according to the doctor's order. The physician prescribes the rate of flow. And complete the label and tape to the IVF bottle. Do aftercare of the materials and wash your hands. It deters the spread of microorganisms. Document the procedure and the client's response. Chart the time, site, device used, solution and rate of flow, and the physician who inserted the needle. This provides accurate documentation and ensures continuity of care. Lastly, monitor periodically at least every 30 minutes to check flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to the
The next procedure is regulating the intravenous flow rate. The purposes of this procedure first is to comply with the prescribed rate ordered by the physician. Next is to maintain an equal and constant rate of fluid administration throughout the duration of the infusion. Next, to assist in reassessing the progress of the fluid infusion. And lastly, to prevent circulatory overload or insufficient correction of hypovolemia. So here are the materials needed for this procedure. Watch with second hand, label, tape, and calculator.
Review the accuracy and completeness of physician's order in client's medical record for client name and correct solution, type, volume, additives, rate, and duration of IV therapy. Follow 10 rights of drug administration. This ensures that correct IV fluid is administered. Assess client's knowledge of how positioning of IV site affects flow rate. Fosters client participation in maintaining most effective position of arm with IV equipment. Nurse is responsible for positioning control clamp or setting infusion device rate.
Hello ma'am, good morning. I am Simon Mamatas, your student nurse for today. And please do not lean on your hand with your IV because it will affect the flow rate of your IV solution. And please do not carry any heavy things with your hand.
Perform hand hygiene to deters the spread of microorganisms.
Hello ma'am, good morning. How are you today? I am Simon Mamatas, your student nurse for today. May I know your name and date of birth? Thank you. Mommy, I see your hand. I'm going to inspect for any signs of swelling, redness. Okay, you are good, ma'am.
Observation or reports of any IV-related complications indicate need to re-establish patent IV access. IV line must be free of kinks, knots, and clots for fluid to infuse at proper rate. Identify client risk for fluid and electrolyte imbalance given type of IV fluid. It helps prioritize assessments. Volume control needs to be strict. And then calculate the flow rate. Use mathematical calculations to obtain correct rate.
Now I am checking the packaging of IV tubing and it says here the drip factor is 60 drops per minute.
Count the drops per minute in the drip chamber. Hold the watch beside the chamber. Holding the watch next to the drip chamber allows the eyes to focus on the drops and the second hand on the watch provide an accurate count. Adjust the IV clamp as needed and recount the drops per minute. This regulates the flow rate into the drip chamber. Record rate of infusion in drops per minute or milliliters per hour in nurse's notes or on parenteral administration form according to agency policy. At change of shift or when leaving on break, report rate of and volume left in infusion to nurse in charge or next nurse assigned to care for client. Last procedure is discontinuing intravenous infusion. Indications include the client's oral fluid intake and hydration status are satisfactory so that no further IV solutions are ordered. Second, there is a problem with infusion that cannot be fixed. And last, the medication administered by IV route are no longer required.
The materials needed for this procedure: dry cotton balls, wet cotton balls, plaster, IVF ticket, empty box for receptacles, and surgical glove. First procedure: check the doctor's order and make an IV label.
This prevents inadvertently discontinuing the IV and having to restart. Wash hands and assemble equipment. Having all equipment available saves time.
Hello Mom, good morning! How are you today? I am Saima Mamatas, your student nurse for today. May I know your name and date of birth? Thank you. Now I am here to discontinue your IV therapy because the doctor's prescribed amount of your IV fluid is already done. So are you ready? Are you okay? Let's start.
Don gloves and clamp the infusion tubing. Clamping the tubing will prevent the fluid from flowing out of the needle on the client or bed. Release anchorage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying countertraction to the skin. Movement of the needle can injure the vein and cause discomfort to the client. Countertraction prevents pulling the skin that causes discomfort. Hold a swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. Pulling out in the line with the vein prevents injury at the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Pressure helps stop the bleeding and prevents injury at the vein. Hold the client's arm or leg above the body if any bleeding persists. Raising the limb decreases blood flow to the area. Check the needle or catheter to make sure it is intact. Report a broken needle or catheter to the nurse in charge immediately. If the broken piece can be palpated, apply a tourniquet above the insertion site. If a piece of needle or tubing remains in the client's vein, it could move certainly toward the heart or lungs and cause serious problems. Application of a tourniquet decreases the possibility of the piece moving until a physician is notified. Then, apply the dry cotton ball to cover IV site. The dressing continues the pressure and covers the open area in the skin, preventing infection. And discard used supplies appropriately. Remove gloves and wash hands. Record the amount of fluid infused on the input and output record sheet on the chart if necessary. Include the type of the solution used, time, and reason for discontinuing the infusion and the client's response. This ensures accurate documentation of client's response.